High blood pressure is a common condition but often overlooked due to its lack of obvious symptoms. Around the world, billions of people are living with this disease without knowing it. It is known as the silent killer because it can quietly cause serious damage to the heart, brain, kidneys, and blood vessels without the patient being aware. Many people still do not know their blood pressure levels, even though a small change could be a warning sign of danger. So what is high blood pressure, what causes it, and how can it be effectively detected and treated? High blood pressure is a serious public health issue, but it can be fully managed if people are properly informed and take proactive preventive measures. Simple actions like regularly monitoring blood pressure at home, having routine checkups, and seeing a doctor when at high risk are the best ways to protect yourself from dangerous complications. Don't let this silent condition unexpectedly take away your health and life. Take action early, live proactively, and stay healthy every day. High blood pressure is a condition in which the force of blood pushing against the walls of the blood vessels is higher than normal. When the heart contracts to pump blood throughout the body, the pressure generated is called systolic blood pressure. When the heart rests between beats, the remaining pressure is called diastolic blood pressure. A normal blood pressure reading for adults is below 120/80 mmHg. If the blood pressure reaches 140/90 mmHg or higher, it is considered high blood pressure. In addition, there is a stage called prehypertension when blood pressure ranges from 130/139/8589 mmHg. If not managed in time, it can progress into a chronic condition. There are many causes of high blood pressure, which are divided into two main categories, primary and secondary. Primary hypertension accounts for the majority of cases and is often related to genetic factors, aging, and unhealthy lifestyles such as high salt intake, obesity, lack of physical activity, and prolonged stress. In contrast, secondary hypertension results from other medical conditions such as renal artery stenosis, hormonal disorders, or congenital heart diseases. Alarmingly, an increasing number of young people under the age of 35 are also developing high blood pressure due to work-related stress, staying up late, using stimulants, and having an unbalanced lifestyle. The problem with high blood pressure is that it is very difficult to detect early because it often has no symptoms. Many people feel completely healthy, with no headaches or dizziness, but only find out their blood pressure is high when it is measured. In some special cases, such as the white coat syndrome, blood pressure rises when seeing a doctor due to anxiety. To make an accurate diagnosis, doctors recommend measuring blood pressure multiple times throughout the day, preferably using a 24-hour Holter monitor to record blood pressure changes during work, rest, sleep, and daily activities. This is an effective way to determine whether blood pressure is truly high or only temporarily elevated. Although it cannot be completely cured in most cases, high blood pressure can still be well controlled if the patient follows treatment guidelines and makes lifestyle changes. Taking medication regularly as prescribed, reducing salt intake, exercising regularly, limiting alcohol, quitting smoking, and maintaining emotional stability will help keep blood pressure stable over the long term. In some cases of secondary hypertension, such as those caused by renal artery stenosis or congenital abnormalities, a complete cure is possible if detected early and treated properly. The important thing is not to wait until the condition becomes severe before starting treatment, because once complications like stroke or heart failure occur, recovery becomes very difficult.